Dr. Warren Froese is a successful orthopedic surgeon in Winnipeg. But there is much more to Dr. Froese than delivering compassionate professional care to athletes and people who have suffered age-related or accidental injury. Back in 1996, Dr. Froese had the opportunity to spend 2 months in an isolated medical mission in the Democratic Republic of the Congo. This experience became a defining component of his professional life.
We fell in love with the people and the place and decided it was something that we wanted to do more of when we had a chance.
While Dr. Froese initially thought he would be bringing his own specialty of orthopedics to patients in the Congo, he soon found that the most significant needs there were very different. One of the toughest things is watching children die from malaria for lack of simple mosquito netting.
That experience specifically, seeing some of those children in dire straits, drilled home for me the reality that orthopedic surgery is not very important in the Congo. Basic health care and helping our Congolese colleagues and friends step up to the plate and get confident and begin running their own show, that matters a lot.
Dr. Froese and a number of colleagues, including Dr. David Hubert and Dr. Donald Dirksen, formed the International Mennonite Health Association and began an innovative and effective strategy to better serve the community for the long term.
For a lot of years it was quite colonial, like Western people would go there, provide care, and leave. And once you leave, there's nothing left. And whatever you established, whatever began, there's nothing to carry on when you go home, which really doesn't help anybody at all.
Their plan is dedicated to training Congolese medical students and to assist them in setting up their own clinic in the heart of Kinshasa.
And that clinic is alive and flourishing, and that's what we've been doing, is supporting them, encouraging them, teaching and helping them with their own education. It's infectious diseases and general medicine that is at the root of their concern, and people die from simple things there that we wouldn't blink an eye at here. So when you see a child dying of cerebral malaria because they don't have treatment, which costs about $1.50, it sort of gets to the core of what's been going on. We've been there for 100 years. We haven't helped them solve that problem. So this tack that we've taken has really been successful in not only addressing that, but helping them address it themselves. So this is Delphin and his wife Regine Capassa, and he's really the leader, the guy who spearheaded this whole thing. Somebody who we got to know about 12 years ago in medical school when he was a young man, and he's grown up, he's married, he has kids, and he's the leader of the clinic, Bomberger in Kinshasa, and provides day-to-day consistency that makes that thing happen. He, together with his colleague Pierre, are the two medical directors, and there's multiple nursing staff and other medical staff that are involved in dealing with people who come through the door on a day-by-day basis.
Dr. Froese speaks with genuine pride about the two doctors that run the clinic.
So we looked for two people who had integrity, who would do what they said they would do, and be honest with the people they hired. In other words, if they were going to hire nurses, they had to pay them. They couldn't keep the money for themselves. And that's been really, really rewarding to watch them take ownership and them take pride in serving their people and finding a way to help their people. And it's incredibly complex because one of the basic issues for care in the Congo is that everybody expects everything to be for free. It's always been for free. But our Congolese colleagues know that there's no future in free. It can't be free. But there's no economy. People don't have a job. So they've started programs to teach women how to sew, and that helps people begin little industries that create economy, that create money. So at their clinic, for the most part, they've decided they will treat their neighborhood once for free, but after that, people have to pay. They have to find a way to make their world turn, because the world hasn't been turning for a long, long time.
In addition to providing badly needed health services in Kinshasa, the clinic promotes self-care, providing education about sanitation and malaria prevention.
To get basic care for the things that matter, like malaria, like mosquito nets, is sometimes harder than you think. So those are the kind of things that they're dreaming of doing, of spreading, so that people don't get sick and die of simple things that can be dealt with on a very simple level.
Dr. Froese recently won the Dr. Jack Armstrong Humanitarian Award, an award presented by Doctors Manitoba that recognizes his many years of selfless humanitarian service. If you would like to make a donation to the International Mennonite Health Association to assist these dedicated doctors in continuing to build a safe and healthier community in Kinshasa and other areas of need, please visit this website, intermenno.net.